Hi, my name is Paulina, and my community health assessment project was focused on the Madison South neighborhood. I decided to look at the Madison South neighborhood because my employer is currently moving into that location, so I thought it would be a good idea to get to know more about the area, the diversity, the health issues affecting the area, just to know more about the neighborhood. And so I thought this was a good idea to do the assessment based on this neighborhood. Um, Madison South is located in the northeast region of the city of Portland, which is in Multnomah County, located in the state of Oregon, and is located in the northern region of the state. Madison South has 7,130 residents and has a high school and a middle school, a couple of community parks in the area. And interestingly enough, the neighborhood is the largest underdeveloped neighborhood left in the city, yet it's the most affluent and diverse only in specific areas of the neighborhood, though. The housing in that area has gone up over the last couple of years, and style of living has also increased in that area. So the diversity, unfortunately, the area that is the most diverse is not the most affluent area of the neighborhood. The population in Madison South is 63.9% most white, while the remaining 36.1% of the population is diverse, with the Asian population making most of that 36% at 14.1%, followed by Black African Americans at 11.6% and Hispanic and Latinos at 8.4%. And it's interesting too because, like I said, the diversity of the neighborhood doesn't really reflect, or lack of diversity in the neighborhood doesn't reflect the diversity in the high school. Madison South High School, the only high school in the area, is pretty diverse, especially because a lot of the transportation system is pretty accessible in the area to high school students, and so a lot of the students going to Madison South to the high school are using the transportation to get there from the surrounding areas. Again, Madison South High School is a lot more diverse. The minority enrollment at the high school is 67%, with Black students making up 17%, Hispanics 24%, Asians at 14%, and then the white population, white students at 33%. In addition, 63% of the student body is economically disadvantaged. And in Madison South, the average age of the neighborhood of the people living there is 37 years of age, and with the majority being males and females, white females and white males. And again, these are mostly working families, young families who've moved into the neighborhood, and are just for the reason that they're moving into the neighborhood, and not as many kids in the child population is a lot less in the area, and again, it does not reflect the high school population in regards to the surrounding area. Just like any neighborhood, Madison South has had a couple of issues and been affected by several health issues in the area. One of them being STDs, HIV/AIDS, opioid and heroin and overdose, and then also suicide. With STD, HIV/AIDS, it's not as common in the area just because HIV/AIDS and STDs tend to affect mostly the African American population, which is a pretty low percentage in the area in Madison South neighborhood. Opioid rates also are a little bit higher, but they are high throughout the state and the county. And it's known that 92% in the area, 92% of death related to opioid and heroin overdose affects males over the age of 44. So again, it is an issue. It's not that big, not a concerning issue for the neighborhood as much as it is the suicides and suicide rates. For this project, I identified the suicide rates as the priority health issue, just because, again, the population is predominantly white, males and females, which is a population that is mostly affected by suicide. In 2013, Oregon was ranked 13th place in suicide incidents and continues to be a persistent health issue. The age-adjusted suicide rate for Oregon is 17.8%, with only 1% difference from the county rate, which is not a very big rate, and it affects, again, the neighborhoods. This neighborhood also, because of the predominantly white population, middle-aged males and females in the area, between their mid-30s up to their mid-40s. Females account for 63% of suicide attempt hospitalizations and have a rate of 68 per 100,000 cases. And in comparison, males are at a rate of 49 per 100,000 cases. The highest rate of suicide attempts among female occur between the ages of 15 to 24 and 35 to 44 years old. Again, the majority of the population in Madison South is female and male, and then also they around that age group. And high school students are also affected, as we can see, the older high school students, but in this population, mostly males and females. And this is why I chose suicide rates as the priority health issue. And there are a lot of factors that affect the suicide rates. One of them is the socioeconomic status of the neighborhood, the lifestyle, the demographics of the neighborhood, of the area. Even though it's underdeveloped, it is also a fast-growing neighborhood, and so it can put a lot of stressors. The amount of how expensive the style of living is in that area, as well as the just different people coming in and out of the neighborhood. So these are some of the stressors that can affect people's mental health, which lead to suicide rates. Again, this was a very great and really interesting project to conduct for this area, being that my university where I work is an integrated health university. So it would be great. It's a great assessment that we conducted, or that we looked at, and it's a good way to have an insight into the neighborhood, to be able to understand a little bit more what goes on there and the type of services that we can provide for the people in the area. Thank you very much for watching and listening to the video.